duly appointed veterinary officer, and I have been asked to speak on general medicine. So, as you know, that veterinary medicine deals with diseases of animals with respect to etiology, epidemiology, pathogenesis, clinical science, diagnosis, differential diagnosis, postmortem finding, treatment, prevention, and control. In routine practice, the veterinarian deals with the diseases of cattle, buffalo, sheep, and goats, which are known as ruminants, camel, which is pseudo-ruminants, horses, pigs, dogs, cat. They are monogastric animals, and birds, poultry, pet birds. Sometimes the veterinarian also have the opportunity to treat the tortoise and turtle, chinkara, black bucks, wild animals in their routine practice also. So as you know that we have three types of animals with us. One is ruminant, another is pseudo-ruminants, and third one is monogastric animals. All these animals have a different type of diseases as per their systems. So veterinary medicine comprises clinical medicine, preventive medicine, forensic medicine, diseases associated with physical agents like lightning strike and electrocution, thermal burn and acid burns, and toxicology, which are of either plant poisoning and chemical poisonings. So, as you know that this clinical medicine deals with systematic diseases, which comprises of various system of the disease animals. Preventive medicine deals with infectious diseases. Forensic medicine or veterinary jurisprudence, it deals with this application of veterinary knowledge for the purpose of law in case of postmortem finding of postmortem of vitiligo cases, wound certificate, injury report, etc. Similarly, this as in our area that sir, in routine veterinary practice, the veterinarian deals with diseases of cattle, buffalo, sheep, and goat, ruminants, camels, pseudo-ruminants, horses, pig, dogs, cat, monogastric, and birds, that is poultry or pet birds. Sometimes wild pets like tortoise, turtle, chinkara, black bucks are also presented for treatment. Next. Veterinary medicine comprises clinical medicine, preventive medicine, forensic medicine, or veterinary jurisprudence. Diseases associated with physical agents like lightning stroke, electrocution, thermal burn, or acid burn. Sometimes we have seen in the field that the acid is thrown on animals intensely, and toxicology, that is plant and chemical poisoning. Other than this, there are two or three branches which generally we rarely deal. One is nuclear medicine, means that application of radioisotopes for the diagnosis of cancer in human beings as well as in animals. And then one sports medicine also, particularly in equines, we deals with in our veterinary practice. Next. This veterinary epidemiology, as I told you that in each disease, we also study epidemiology, and it is a very important branch of veterinary medicine. This is an important component of veterinary medicine. The following parameters are considered for each disease, because each disease have its own epidemiology. This aspect is, I say, that comparatively poor for reporting the diseases of animals in our routine practice, which we have to improve. This veterinary epidemiology include occurrence, that is area, means disease occurs in which part of the Rajasthan or India, or whether this disease is prevalent worldwide. As we seen in case of LSD, this was present at that time in India and our neighbor country also. For example, this contagious bovine pneumonia, it was earlier restricted to northeast area, but now what is its status, I don't know. Then in epidemiology, we also study prevalence and incidence. As you know that prevalence include old and new cases, whereas incidents include only new cases. So while studying any disease outbreak, we must study prevalence of the disease or incidence of the disease. Then for every disease, we must study morbidity and mortality. This morbidity and mortality varies from disease to disease. In some cases, morbidity may be 100%. In some cases, it may be 5 to 10%. So it varies from disease to disease. And mortality means that how many animals have died. Similarly, there is a one more this. Then comes to clinical medicine. The other factor which deals with age and sex. Some diseases are age related and sex related. And nowadays, this stress is also an important factor, that is climate change causes the disease. Next. Clinical medicine deal with diseases. Sir, back, please back. Clinical medicine deals with systematic diseases of digestive, respiratory, urinary, nervous, cardiovascular system, including diseases of skin and eyes. Among systematic diseases of digestive system like rumen infection, a very important condition, enteritis, tympani, acid indigestion, and alkaline indigestion, which occurs are important cause of one of the more important disease, that is rumen infection, which is due to poorly powder which contains sand and fine. So in particularly in stray animals, this poor quality fodder and large food particles and ingestion of non-metal foreign bodies like plastic and leather also causes this rumen infection. Next, sir. Then in back, sir, back, please back, sir. In clinical medicine, we also deals with deficiency diseases. The deficiency diseases are of three types: vitamin deficiency, vitamin A, B, C, D, then macro minerals, that is calcium, phosphorus, sodium, potassium, chloride, magnesium, and sulfur. Similarly, micro minerals which are required small quantity, we also called them minerals, that is manganese, copper, iodine, zinc, cobalt, and selenium. Macro minerals are required in large quantity as compared to micro minerals. Next, sir. Next. Now that impacted rumen does not respond to our standard treatment. However, we can try the following line of treatment in case of impacted rumen of digestive system diseases, that we must administer lukewarm water 5 to 10 liters through stomach tubes. So each field vet should have a stomach tube of good quality. Then to improve rumen motility, we can give calcium bicarbonate or thiamine hydrochloride. Purgative as magnesium sulfate, the dose is 250 gram orally should be given. Then 5 liters of rumen curd. What happens that when the animal remain off feed for 5 to 7 days or more than this, what happens is this rumen protozoa and bacteria, they become inactive or they may also die. So this administration of rumen curd from healthy animal through stomach tube help to relieve this rumen infection. Then fluid therapy is very important, particularly through two types of fluid, that is normal saline solution and Ringer's lactate. The veterinarian should know the exact dose. What happened due to the poor condition of the farmer, we generally administer this fluid, particularly this normal saline or Ringer's lactate or even normal dextrose saline in less quantity. So taking consideration into the dose 25 ml per kg body weight, we should administer fluid to the off-feed animals. Then ginger powder at the dose rate of 50 milligram per kg body weight orally, it increases the reticuloruminal contraction. We can also give this neostigmine at the dose rate of 0.02 to 0.04 milligram per kg weight subcut, but only thing that there should be no obstruction, otherwise there is a perforation also. Or the veterinarian can use Nux vomica, homeopathic drugs, 200 potency, 5 ml orally BD for 5 to 6 days, that it also responds in cases of impacted rumen. Next. Sir, next. In respiratory system, back, sir, back, please. In respiratory system diseases, the veterinarian should use this diuretic, because what happens, there is in particularly pneumonia, there is a pulmonary edema, so there is open mouth breathing. The veterinarian should use diuretic like Lasix or any other available diuretic plus the steroids that will check the permeability of the capillary, and ultimately the edema will be checked. Then in case these two conditions, that is acid indigestion and alkaline indigestion, are common problem in the field practice. What happened during this marriage occasion, we have seen that the leftover is thrown out of the from this the hotels, etc., and the stray animal when ingest this rice or sometimes this chapati or sugar syrup, this spoiled potatoes or grapes, they can cause acid indigestion, which we can diagnose through rumen pH. Similarly, alkaline indigestion is caused through ingestion of this highly rich protein diet or urea in small quantity, because urea in excess causes the urea poisoning. In acid indigestion, we should change the pH as well as to check systematic acidosis. That is metabolic acidosis. We should give large quantity of fluid therapy. In alkaline indigestion, we should give sirca or so-called vinegar. This 500 ml vinegar diluted in 2 to 3 liter water, because it should not be given vinegar. 5% vinegar cause stomatitis. It should be administered diluted with 2 to 3 liter of water, 500 ml vinegar. If the animal is off it 4 to 5 days, then what happens? That the human content is about 70 liter in adult animal daily. So you can imagine that if the secretion of saliva is a continuous process. So while taking the rumen, we should be very careful whether it is due to saliva or examination of rumen pH is very important to differentiate acid indigestion and alkaline indigestion. The normal rumen pH is 6.8 to 7.2 depending upon the feeding practice. In digestive system, I here want to mention particularly in horses, colic is very important disease, and there are so many causes of colic, that is spasmodic colic, flatulent colic, obstructive colic, gastric ulcer. But to the field veterinarian, I would like to suggest that one of the cause of colic is gastric ulcer, and in that case, if you give pantoprazole 200 milligram IV, it will give the immediate relief to the horse. So in particularly colic, there are one more causes is gastric distension. So while giving this liquid paraffin to the horses, first we should administer the stomach tube, and then it's lower down the head of the animal. Sometimes the stomach is distended with fluid, and if we give liquid paraffin like 2 to 3 liters, then it will cause further distension and rupture of the stomach. So we call it as a reflex action. So while giving any fluid to the horses, first we should lower down the head of the animal after after passing of stomach tube. If fluid is out, no liquid paraffin should be given. Next. Then it comes to nutritional deficiency diseases due to vitamins, minerals are also common in our veterinary practice. As you know that we have vitamin E deficiency because availability of green is limited. So vitamin E is essential for so many functions like reproduction, for skin, for brain. But in camel, we have seen that vitamin A deficiency causes night blindness. Similarly, that in our teaching, we told that the ruminant synthesize adequate quantity of B complex in the rumen. In spite of that, we see that there is a large number of cases of this polioencephalomalacia or B1 deficiency in all the animals, in particular, including ruminants also, because what happened that the synthesized vitamin B1 in the rumen is destroyed by thymidase enzymes, which is present in the plants itself. Then comes to vitamin C, it causes scurvy, that is bleeding from the gums in the dogs. Vitamin D causes rickets. This is a common practice because our pet animals are not exposed to sun for vitamin D synthesis. So due to non-exposure to sun, vitamin D, we should supplement in the diet. And vitamin E, it causes white muscle disease in the young cows. Next, sir. Change, sir. Next. Then another, this back, sir, back, please. Back it, back it. Another part which is covered by this next speaker, but simply I will tell you that preventive measures deal with infectious diseases which are of two types, contagious, non-contagious, and these infectious diseases also include zoonotic diseases, that bacteria, viruses, protozoa, mycoplasma, external parasite, tick, mite, lice, internal parasite, nematode, trematode. Here my main suggestion to the field veterinarian that for deworming, you should use a specific dewormer which is 100% effective. Like for tapeworm, this Regiquintal is the drug of choice. For trematode, the drug of choice we have two, that is triclobendazole and oxychlorobenzidine. So for nematodes, we this fenbendazole etc. are given. So there is no single parasite which covers nematode, trematode, and cystode. Next. Another, this chlamydia which causes very limited diseases, and this prion, infectious agent which causes two diseases in the veterinary practice, that is mad cow disease and scrapie. Though these two diseases, that is scrapie in the sheep and mad cow disease in cattle, has not been reported from the India. I don't know when the prion disease are present in the human beings, and in human being it is caused by the this eating of the sheep and goat brain. So we have to think about these two diseases which are prevalent in human beings as a Creutzfeldt-Jakob disease. In infectious diseases, proper collection and proper sampling is very important for isolation and identification of the agents. Here I also want to give one more suggestion to field vet which are newly appointed, that they should be very much conscious about these zoonotic diseases, particularly brucellosis, because the number of cases of brucellosis in human beings, particularly vet and paravet, is increasing over the years, and the source is only animals. That is abortion, which causes abortion. We treat, remove the placenta. So then leptospirosis is also very common, but because there is no treatment for brucellosis in animals, these leptospirosis and listeriosis are two important bacterial diseases which respond to treatment. But still, being a zoonotic nature, if it is that if the diagnosis is delayed in human beings for 4 days, it causes in leptospirosis renal failure. In listeriosis, it causes severe encephalitis. The next zoonotic disease which we have recently seen in Rajasthan, in Bikaner also, that is glanders in horses. So this new vet should be very careful while treating handling zoonotic diseases. Then another important aspect in medicine, that is diagnosis. Diagnosis of any disease is very important for the treatment of the animals. So we can diagnose the disease on the basis of history and symptoms, which is very important. We should take the history, then physical examination, which include recording of the temperature, pulse, and respiration of the animals. Next. Change. Next. Then examination eye for congestion and anemia, because in our veterinary practice we have a large number of this worm infestation which causes severe anemia. So examination of eyes is also essential. Then examination of lymph gland is also very essential because we have a large number of protozoal diseases, babesiosis, filariasis, rickettsial disease, anaplasmosis, etc. So that will help in our diagnosis. Then auscultation of the heart, lung, rumen, and sometimes intestine also for barbering sound. For rumen contraction, we should examine the rumen. Then, though we don't have in our at hospital practice as in human being that blood examination and serum chemistry, because for nowadays for this blood CBC complete blood examination and like liver function test or renal function test help in the diagnosis of the liver, kidney or bacterial or viral infection. Urine examination is also important, particularly this for ketosis and subclinical ketosis. Fecal examination is very important for parasitic diseases. Rumen content should be examined for pH and protozoa. Milk examination for subclinical mastitis, because clinical mastitis can be diagnosed easily. Response to treatment. If the animal responds to treatment, it means your diagnosis was okay. Then for various serological tests are nowadays applied. For example, in glandular CFT, that is complement fixation test is applied. And for identification of bacteria, etc., this PCR, that is molecular techniques are available, which can this identify the organism within 6 to 8 hours. Then examination of the skin strapping for fungal and mite diseases. Next. Then for every disease, differential diagnosis is also very important. For example, I just give one example, hemoglobinuria, that it can occur in post-parturient hemoglobinuria, in case of bacillary hemoglobinuria, and in babesiosis. So treatment is different in all these three conditions. So we can diagnose babesiosis by blood film examination. This bacillary hemoglobinuria is a Clostridium disease which responds to penicillin, and PPH is a uncertain etiology. It may be phosphorus deficiency or some other causes also. Then in our routine practice, we also have a production and metabolic diseases, that is milk fever, ketosis, subclinical ketosis, Downer cow syndrome, acute hypokalemia, and hypomagnesium tetany. Next. Here I want this very important condition which field veterinarian should be very much concerned about. This hypokalemia means deficiency of potassium, particularly in the recently participated animals, because this low potassium causes the general muscle weakness and Downer cow syndromes. Treatment is potassium chloride 10 30 ml IV slow, but oral potassium chloride at the dose rate of 120 gram BD should be given to the animal. Sometimes this isoflurperidone acetate, that is a steroid, when used in longer time, it causes hypokalemia. So we should use judiciously. Next. Next, sir. Then in Rajasthan, we have seen plant toxicity, that is SCN poisoning due to the stunted growth of this jawar, lantana poisoning which causes photosensitization, and in this Kota Bundi area, that this one plant causes oxalate poisoning. What happens? This plant contains soluble oxalate. When it is ingested by the ruminants, it chelates with calcium, and there is a formation of calcium oxalate, and it causes hypocalcemia, and animal adopt recumbency, and if this calcium oxalate is deposited in the kidney, it causes hematuria. Then there one more important disease in mastitis, that is these two conditions are nowadays. One important condition is blood in milk. Generally, it should be respond to the hemostat as we use in our veterinary practice. But I have seen that this condition not respond to even our standard treatment, that is hemostat. We have administered 1 ml adrenaline with 9 ml distilled water intramammary. Even we have used this our desi treatment, that is Kapoor in banana. So you can this puja kapoor is taken these 2 tablets and put in the banana. It gives to the animal. Some animal respond to this condition, and I have seen that. I don't know what is the justification, but use of this progesterone 2 ml hormone for 3 days. In case of blood in milk, it also gives very good results. So we can try it. Then in this mammary gland, one more problem, that is herpes virus mammalitis. So the veterinarian should use antiviral drug, that is acyclovir 5 milligram per kg body weight IV. This is a human preparation. Or one, it is was found very effective in this herpes virus infection and even LSD also. And now this one new drug that is not available in Rajasthan, but shortly it will be available, that is bio-enhanced methylene blue 25 ml diluted, and it is given orally to the animals in can cause cure the animals. Then next one more disease. This recently this Congo Crimean Congo hemorrhagic fever. This is a zoonotic disease, but it is said that in animals, that is in cattle, buffalo, sheep, goat, it is amplifying host, but in human being there is a one death. A lady from Jodhpur was admitted and it died due to this Congo fever. But veterinarians should also be careful because it is transmitted through ticks. So, few tips I want to give to the field veterinarian, that in field care we also found this magnesium deficiency. So you can use 20% magnesium sulfate 200 solution 200 ml IV, or in second day you can use 50% magnesium sulfate subcut only, because saturated solution used as a euthanasia, but at the same time if you give it subcutaneous 50% solution 200 ml, it will be very effective. And I think there is one more tips which I want to give you, that in case of in our Jaisalmer, Flodi, Jodhpur area, we find lot of clinical cases of botulism, that is due to phosphorus deficiency. So these, because there is no vaccine for botulism in cattle, and every year thousands of animals die due to botulism. So in that area, a good quality of mineral mixture, or you can give this sodium acid phosphate regularly, or having a large, because in Australia they use vaccine, or otherwise they give specific mineral mixture, area specific mineral mixture to the animals. Only one more important disease, which that is was PPS, which was included in earlier in the metabolic disease, but now it has been found that it is a disease of uncertain etiology. It is more common. Earlier it was post-parturient hemoglobinuria. Now it is found in many cases of pre-parturient also. Here the important point to the field vet is that this sodium acid phosphate should used only 30 gram dissolved in 300 ml once only, because it is highly acidic and causes itself its death in the animals, because its etiology is not clear. Earlier we were giving 60 gram IV. Now it should be given only single dose, 20 gram to 30 gram. Then we can give orally 120 gram sodium acid phosphate for 3 to 4 days. Or say in Punjab area, this PPH, that is post-parturient hemoglobinuria, is caused by copper deficiency. So we give in our treatment, but in Rajasthan I have seen not a single case, whether it is a pre-parturient or post-parturient. The only treatment is blood transfusion if possible. In veterinary practice, in case of PPH, when the hemoglobin comes to 4 gram or 5 gram, 10-liter blood transfusion is required, and that can be because in for veterinary practice no this blood collection bag is available. Otherwise, in first time we can directly infused 5 to 10 liter blood from a similar animals without any matching. So with this, thanks to for listening me. I hope if any field vet have any problems with regards to treatment, diagnosis or vitro cases, he can contact me. I have no objection to field vet from my side. Thank you. अपना काम तो खत्म होगा, लेक्चर दे भी 4 ही घंटा अगले वो करेंगे, ठीक है। तो ये तो बोलेगा नहीं क्या, थैंक यू डॉक्टर साहब, बोलना बोला ही नहीं। हाँ? कर दिया हमने। ये तो है, बेटा उसकी बात है।
हाँ, प्रेजेंट मोड में है ना आपका ये?
हाँ सर।
प्रेजेंटेशन मोड में है ना ये?
हाँ सर, जो आपने दिया वही है सर।
चले स्टार्ट। थैंक यू।
आप देख पा रहे हैं
तो
प्रेजेंटेशन में?
So first of all, I highly thankful to Joint Director Sir, RSMTI, Dr. Anil Sharma Sir, and my senior Dr. Ashok Mehti sir for giving me this opportunity to interact with the newly appointed veterinary officer. And I have given the topic to discuss with you all is the preventive veterinary medicine. Next, please. So in this presentation, I have summarized in following topics. First of all, we discuss about the significance. Hello.
सर आपकी आवाज क्लियर नहीं है, थोड़ा तेज बोलिए, तेज लाओ।
So this presentation includes first of all the significance of preventive veterinary medicine. आप clear है? Types of infectious diseases. Then we will discuss about the herd health management practices, infection control, prevention and biosecurity measures, and conclusions. Next, please. So while discussing this preventive medicine, we all know that there are two parts of veterinary medicine. First is veterinary clinical medicine and preventive veterinary medicine. As we all know that this clinical medicine deals with individual animal and it's focus on the treatment and care of the individual animal, while preventive medicine solve the herd problem, means the group of animals as affected by the infective organism. So this medicine also known as herd health medicine, and this medicine involves a teamwork. So to treat or to face the challenges of infectious diseases, we need a teamwork. Preventive medicine includes all the infectious diseases that occurs commonly in our day-to-day life or in field condition, especially in the outer remote areas. Please, next. Next, please. So the significance of preventive medicine is the branch of veterinary medicine that covers the diseases of infectious origin and contagious nature. Their occurrence among animal population and prevention and control measures by suitable and appropriate measures. So these that lead to the occurrence of infectious and contagious diseases face challenges by field veterinarians as well as the administrative. That the example of recent 2 years back, the lumpy skin disease, we all veterinarians face preventive infection control, prevention, biosecurity measures. The veterinary care services, either the primary or referral settings, the efforts at disease prevention and treatment are always compromised, and sometimes they are nullified. So the continuous surveillance, monitoring, preventive measures, and reporting is very much necessary to face the challenges of infectious diseases. Next, please. Singh et al., the scientists of IVRI Vareli, in a study estimated the economic losses due to the FMD disease in India in the year 2013, and reported economic losses due to this disease were around 1200 crores to 14 crores in India. So that's why the impact of these infectious diseases can be summarized on this example of FMD disease. So the FMD still exists in our some parts of Rajasthan and all over India also. And government India is also running a controlling program particularly for this disease. Next, please. Likewise, Amardeep and workers in the year 2023, they investigated the impact of lumpy skin disease outbreak in India for the total bovine affected from the July 2022 to December, October 22, and reported that 45% morbidity in cattle, while buffalo it was just around less than 1%, and the mortality was higher in cattle around 11,035 crore, 19,000 crore rupees. So we can imagine the impact of this LSD. So the main significance of that to the nation as a whole is very, very big. So that's why we must focus on all the measures to control these infectious diseases at their primary stage. So the impact of these diseases is very much high, and that needs the teamwork. That's why I am saying again and again that control measures to these infectious diseases involves a teamwork. Next, please. Now, this is the primary information. All veterinarians know very well about these type of infection because the infectious diseases, group of diseases results from the invasion of animal body by infective organisms like protozoa, this bacteria, virus, yeast, and fungus, etc. So the diversity of this infectious diseases is very much. The diversity in terms of the positive organisms, that is viral, bacterial, fungal, parasitic, endoparasitic, ectoparasitic, as well the diversity of this host diversity, because uh, uh, the all the species like cattle, buffalo, sheep, goat, equine, swine, camel, poultry, wild animals, all animal species are affected with all the infectious and contagious disease. That's why these all as a compile makes the controlling measure very challengeable to all the concerned persons. The common example of these bacterial viral diseases are, we all know that in viral disease, the random test, PPR, FMD, LSD, rabies, and in case of dogs, canine parvovirus, canine distemper. In case of horse, it is African horse sickness, equine infectious anemia. In case of bacterial disease, some common diseases are tetanus, hemolytic septicemia, black water, enterotoxemia, tuberculosis, anthrax, brucellosis, leptospirosis, and there is all a very big, all we all know about the list of these diseases. Next, please. So the contagious disease means they spread by direct contact, either direct contact or indirect contact. But sometimes there may be involvement of reservoirs. So the Spread of disease of all infectious disease directly or indirectly occurs, and all contagious diseases are infectious, but all infectious diseases may not be contagious. So the list of these infectious diseases very much includes all the infectious organisms. Next, please. Based on the course of the disease of infectious origin can be grouped into four categories, that is per acute, acute, subacute, and chronic. On the basis of the time duration, the occurrence of the signs, and the severity of the pathogen, the disease either may be per acute. In this, the course is very few minutes to few hours. For example, in case of anthrax, it is less than 3 days, means 72 hours. Likewise, HS also is a for acute disease. Acute disease, it's involve around 15 days course. Then subacute more than 4 weeks. Depends on the pathogenicity of the organism and the severity and the morbidity and mortality condition occurs in the field condition. Next, please. Likewise, the diseases are again grouped into four categories, that is the occurrence. Either sporadic disease means sometimes occur endemic in a particular area, epidemic covering a more region or state, and the pandemic means they occur at a time including several countries. So we all know about these terms very well. Next, please. Here is the main focus, the prevention and control of infectious and contagious diseases in Animal Act 2009, Act number 27 of 2009. This act goes into announcement on the 20th March 2009. In this, Government of India has notified the list of the main infectious diseases. So that's why I just want to share this information with all the newly appointed field vets, that this list gives us an idea how to we face the challenges or which diseases we have to keep in mind while dealing with this infectious diseases in field condition. In this act, to provide the prevention, control, and eradication of infectious and contagious diseases affecting animals, for prevention of outbreak or spreading of such diseases from one state to another, and to meet the international obligation of India for facilitating import and export of animals and animal products, and for matters connected therewith or incidental thereto. So that's why this list gives us a brief idea that the diseases are very much important. So next, please. So in this list, we can say the first list, the multiple species diseases, means all species, all domestic and ruminant species are affected by these diseases. It includes anthrax, this is Audesky disease, blue tongue, brucellosis, Demon Congo, Mediterranean fever, echinococcus, FMD, heart water, Japanese encephalitis, leptospirosis, then New World screwworm, Old World screwworm, paratuberculosis, Q fever, rabies, Rift Valley fever, rinderpest, trichinosis, toleremia, vesicular stomatitis, and West Nile fever. So these 21 diseases are regarded as the diseases of infectious origin and are notifiable and affects all species. Next, please. In second list, the disease that affects cattle, especially the bovine anaplasmosis, babesiosis, the bovine campylobacteriosis, spongiform encephalitis, tuberculosis, BBD, bovine diarrhea, contagious bovine pneumonia, angiotic bovine leukosis, hemorrhagic septicemia, infectious bovine rhinotracheitis, IBR, lumpy skin disease, LSD, malignant catarrhal fever, filariasis, trichomoniasis, and trypanosomiasis. So these 15 diseases has been notified at the this Prevention of Infectious Disease Act 2009 and affects mostly the cattle. Next, please. The next list is of the diseases affecting the sheep and goat. This includes 11 diseases, including the caprine arthritis, encephalitis, contagious agalexia, contagious caprine pneumonia, angiotic abortion, Medi Nairobi sheep disease, ovine epididymitis, Pachydes PTR, salmonellosis, scrapie, and sheep pox and goat pox. Next, please. Next list is of equine disease. The disease notifiable diseases of equine species are African horse sickness, contagious equine metritis, Dorine, equine encephalomyelitis, equine encephalomyelitis of two types, eastern and western, equine infectious anemia, equine influenza, equine pyroplasmosis, equine rhinopneumonitis, equine viral arteritis, glanders, Serra means trypanosomias evansi, and Venezuelan equine encephalomyelitis. These 13 diseases have been notified by Government of India under this Act 2009. So, next please. The next list of the diseases affecting the poultry or species. This includes 14 notifiable diseases, avian infectious bronchitis, avian infectious laryngomyositis, avian mycoplasmosis by Gallinatum septicum or Mycoplasma synovium, then duck viral hepatitis, fowl cholera, fowl typhoid. Next is highly pathogenic avian influenza, or we know that this affects very much poultry birds in our India, not only in India but other parts of the world also. Then infectious bursal disease, mumps disease, Newcastle disease, florum disease, and turkey rhinotracheitis. So these 14 diseases of poultry also very important. And among this, the avian influenza or bird flu, we all know very well about this disease. Is very serious concern to the poorest poultry farmers in our state and all over India and also in other parts of world like China, Indonesia, Bangladesh. Like next, please. Next list is of the diseases of swine. The tick also a very common species. So the African swine fever, classical swine fever, Nipah virus, porcine cysticercosis, porcine reproductive and respiratory syndrome, swine vesicular disease, and transmissible gastroenteritis. These diseases are of importance in swine. And two other diseases, they are also included in this Act 2009. It includes camel pox and leishmaniasis. So this list sensitize you young all veterinarians that there is list the diseases included in this list. We always have a basic knowledge about how to deal, how to face the field condition. So the basic knowledge of each disease, the symptoms, clinical symptoms, their main pathognomonic signs, how to conduct the postmortem or how to collect their samples to make diagnosis or at an early stage, or including the available vaccination program so that their disease can be prevented at an early stage to reduce the economic losses to a particular person or as a nation whole. Next, please. So after this, having brief knowledge or information about the various types of diseases that are included in preventive medicine, now the control measures. So this hard health medicine also regarded as a part of treatment of, but we all know that it is differs from clinical medicine in all some basic points that in clinical medicine we always feel free to deal with clinical diseases. But in case of these infectious diseases, particularly the contagious diseases and the paracute diseases, always have the basic knowledge about the occurrence, about their epidemiology, about the impact, and at the same time the available preventive measures, including the from diagnosis by collecting the accurate sample, then reporting to the higher authorities, then vaccination at all the affected area, including the isolation and segregation of the closely affected animals. So this herd health management practices means the practices of management and care of animals by humans, including veterinarians. So this practice or preventive measures to combat the infectious diseases, particularly the paracute diseases. We need a teamwork. So that's why I'm uh, again it's my suggestion or the need of time that in field condition we always need help not only from the technical person but from the owner also. Without their help, without their cooperation, without their reporting, we cannot control the situation of any outbreak in field condition. So that's our primary need is the involvement of the all concerned person, including the humans, along with the technical person means veterinarians. So the objective of preventive medicine can be achieved only when we have a good teamwork. So that's why this preventive medicine, always known as herd health medicine, or it involves a teamwork. Next, please. So coming to the this preventive veterinary medicine, we know as infectious diseases are continuing to be a significant obstacle in the way of the expansion of further development of the animal product industry. So a very initial diagnosis by means of proper available facilities. We need to develop the required facilities at these veterinary facilities at treatment centers. Either it may be a sub center or a veterinary hospital or a veterinary polyclinic. We need some basic facilities. Also, at the same time, we need the proper reporting system so that any sporadic disease or any endemic disease condition may be notified at an early stage. Sometimes, for example, in case of hemorrhagic septicemia or FMD, the particular area faces the challenges particular area faces outbreaks regularly. So in that condition, the field veterinarians may be given alert in advance to control or to prevent the occurring situation at an early stage. Next, please. So the development in the particular, we can say the product now animal utility. So development why it occurs and it is the time because the cost of rearing animals is very much increasing regularly. So that's why there is more free trades and competition in farm products. Industrialization of farming and animal husbandry practices are being continuously upgrading. Animals in large scientific and sophisticated areas are being maintained. Some companies, private sector companies, or some person. We all know some dairy farms, or they very they are being organized very scientifically by some non-vets. So that's why these development facilities they giving an opportunity not only to veterinarians but all other concerned person to make regular visit and to make surveillance practices more efficiently to rule out the occurrence of any outbreak condition in that condition. Now, minimization of investment cost for animal facilities. Individual productivity has increased very much by selected breeding. Now we know that now Highlanders animals are being kept by owners. Animals are forced to the maximum limits of their productivity. So this increasing in the productivity makes animal prone for occurrence of the primary disease. Primary disease means the viral diseases. All viral diseases are regarded as primary diseases. So when the immunity of animals being compromised due to this high production stage or any other condition, stress condition or the change or transportation or poor nutrition condition, the decrease in the immunity level always make animal to be susceptible for these all type of infectious diseases. Next, please. So when there is development, continuous development in the animal products, their productivity being increased, there are some consequences of this development, animal health problems. As I am discussing that due to their high productivity, their resistance power is being decreased and their susceptibility for infectious diseases is increasing. So at the same time, when animal are being reared in a very scientific way, or sometimes their condition is not scientifically being maintained. So there are some issues like animal welfare. So this animal welfare part also we have to look after that no animal should be kept in a poor condition. The basic requirement of housing, sanitation, and nutrition should be maintained at farm so that this animal welfare condition can be maintained at optimum level. Now, the usage of large amount of medicine when there is condition of an outbreak to treat the condition, we need uh, good amount of medicine, so the cost increases. At the same time, the use of high amount of this medicine, including particularly the antibiotics, there is now very again another challenge, that is antimicrobial resistance. So this condition is very much common. It is being faced not only in India but all over the world. So antimicrobial resistance coming to the humans through the animals or the animal products, we can say. So this antimicrobial resistance also pose a very big challenge to all, including veterinarians. The consumer interest increased because the demand daily food at a low price, and they are also aware about the animal welfare. And some NGOs are also working in India, not only India, all over the world. They demand that the animals should be kept at a ideal conditions, the proper hygiene condition, proper housing condition, proper medicine, proper care, proper management. So animal welfare practices are also a concern to all of us, particularly in field conditions. Sometimes we see the condition of a particular dairy farm is not up to the scientific conditions. The concern about the residue in food of animals, we also know that this antimicrobial resistance is a very big concern to all of us, particularly to the future generation. Next, please. So, what to do? So, now to make herd health in a good condition, or means that all the animals in good condition, we need to keep the animals in good health. And this good health can only be maintained by providing their basics requirement in terms of their housing, proper space, proper ventilation, proper feeding condition, proper watering condition, the use of of sanitization, immunization also, and to improve the animal welfare, then to produce the safe food for human consumption at a reasonable rate. So these all leads to start a herd health management program. The veterinarian has to develop strategies to improve animal and welfare and to produce safe food. Farmers should pay more attention to animal health and welfare and safe food. So uh, this statement summarizes the emphasis not of the veterinarian but of farmers. So both can make the herd health in a good condition. So field veterinarians, we need as a field veterinarian, we have to justify the requirement of each and every individual animal when we visit any particular farmer outdoor, then we should always give him advice about the animal welfare practices also. If the owner or the farmer we are able to sensitize him or her with these animal welfare practices, he, I think, automatically try to improve the animal husbandry practices, and all these uh, practices, all these condition will automatically improve the herd health, and they also in particular give more profit to the owner in terms of the less cost, and their productivity may improve, and ultimately we can improve the production at national level. Next please. So this is her health management. While we dealing with this clinical disease, sometimes the condition are of such importance that visible clinical signs may not observe, particularly in case of, for example, mastitis. So the losses, economic losses due to mastitis, subclinical mastitis are much more as compared to clinical mastitis. So regular scheduled visit to animal farm are the primary concern to all field veterinarians or as a practitioner, and they ultimately requires at the each and every step. So regular scheduled visits to animal farms, they help us in surveillance, monitoring, and also to find out any outbreak condition at an early stage. So the outbreak can be prevented at early stage. Next, please. So this herd health mainly influenced by, as I have told earlier, that housing condition, feeding condition, hygienic measures, infection, any previous infection, transportation, any new animal has been added, or some uh, other unauthorized person moving into the farm, the breeding and other management practices. So these all factors help in maintaining animal in good health condition. Next, please. So the goal of herd management includes to eliminate production inefficiencies which are caused by factors that impair animal health. The animals and animal products entering the food chain, dairy or slaughterhouse must be free from the diseases and residue. So a good health management program is a total quality assurance system that consists of regular scheduled visits or veterinary activities, including the deworming, vaccination, regular awareness programs, including the TV news or newspaper news, etc., and also at the same time good herd management by the farmers. So educating the farmers about the new scientific practices or the aspects of animal welfare They help us in particular to achieving our goals of good herd health management. Next, please. The cornerstone of herd health management includes a competent veterinarians. So first, as a veterinarian, we need the basic knowledge of these infectious diseases, particularly the notifiable diseases. As I have told earlier, that our competency as a veterinarians, we can improve our competencies by regular improving our skill, our information, our knowledge by having daily news or any news or information coming particularly during any season or in a particular area, the history, the epidemiological history of a particular area. So as a veterinarian, I must suggest the newly appointed veterinarians that where are you in you are having your posting place, please go through uh, epidemiological data, your history of your place of posting, that in which season this particular disease outbreak have been reported earlier, or which types of animals are being maintained in your area. For example, if you are posted at a Jodhpur or this Jaipur region, you may face different types of challenges as compared to a person or a veteran who is being posted at Jaisalmer or some other parts of our state. So the occurrence of outbreaks differs accordingly in a particular area. There may be chances of a particular disease like anthrax. Anthrax is only reported in case of Nagaur, some belt of Jaisalmer. But nowadays we cannot see in any case last from 30 years. Or if present, there is absence of reporting system also. So as a veterinarians, you must focus on the occurrence of any history of occurrence of any disease in your area. Now, again, we need specialist integrated services that needs from diagnostic and treatment facilities. So for diagnosis, we need the basic requirement of some collection of the samples that needed to be collected at a particular disease condition or outbreak condition. So basic knowledge about particular disease, which type of disease, which species is being affected, or it is a zoonotic important disease. We must focus on diagnosis as well as the treatment protocols, then the prevention and control. So monitoring, surveillance, diagnosis and treatment, prevention and control. These all integrated services are required to control outbreak at an early stage. The services must be delivered promptly and economically. A farmer who is committed to the program comply with the recommendation of the veterinarian. So as I have told earlier that the cooperation of farmers or person who are involved in this prevention program uh, must have knowledge, basic knowledge how to handle or how to provide the necessary care to the affected animals. A good data recording and reporting system also needed to control or to make the our mission successful. So data recording and reporting. Sometimes we have seen the cases of outbreak like in field condition the hemorrhagic septicemia. The HS case sometimes notice, but the veterinarians who is dealing with or the person who is the owner means I mean to say the owner not reported the condition, and that leads to the accumulation of that condition and ultimately a big area affected by particular disease. So the continual appearance of emerging as well as the re-emerging diseases also all-time challenge to all concerned, including bacteria. Next, please. So this herd health immune system means the herd immunity. Immunity in a population disease transmission may stop before all susceptible individuals are infected. It is known as immunity. Herd immunity is the resistance of a group to attack from a disease to which a large portion of members are immune, thus lessening the likelihood of a patient with a disease coming into contact with a susceptible individual. So this ultimate goal of herd health management is to achieve the herd immunity. In case of LSD, the LSD has been controlled when we achieve the herd immunity level. So as a veterinarian, we all know the basic concept about this herd health or herd immunity. So the significance of preventive medicine, ultimately the goal is to achieve the herd immunity. Next, please. Next, please. So requirement of a herd immunity, the disease agent is restricted to a single host species within which transmission occurs. For example, smallpox in humans, no reservoir, then the contact should be least direct contact should be always be avoided in case of pox of animal, in case of goat pox or sheep pox. The isolation is very much primary requirement to to achieve the con- to the herd immunity. Next, please. The factors that affect the success of herd immunity. The success of herd immunity is controlling the infectious disease depends on the proportion of animals with immunity in a population. So, in case of an outbreak of infectious disease, for example, HS, the closely closely related animals, close contact animals should always be first isolated, then the unaffected animals should be vaccinated, that is known as ring vaccination, and the animals showing the signs should be treated accordingly, and if the animal dies, their disposal should be at, as per according to their needs or the as per protocols. So immunity can be from vaccination. So this immunity comes through active immunization. Next, please. Now, prevents the next topic of this preventive medicine. This is the part and last part, the principle of infection control, prevention and biosecurity. Most of topics have been covered by me. And next is the main principles. Principles means some basic guidelines are there how we deal with these outbreak condition in field conditions. So for the newly appointed veterinarians, I must suggest that you must follow these protocols. You must have basic information about each and every specific disease affecting a specific species or it is a multi-species disease. And the protocols must be followed as per the need and keeping in mind the zoonotic importance also at the same time in case of this avian influenza or any other zoonotic disease. Next, please. So this term biosecurity means not only the prevention control among animal population, but also decreasing or eliminating the chances of the affecting the humans or mankind. So the term biosecurity refers to a collection of precautions used to protect a farm, herd, or flock from the introduction and further spread of the illness. Both physical and management techniques are included in biosecurity measures with the goal of reducing the likelihood of disease transmission from animals to humans and from humans to the environment. So the ultimate goal, or we can say the prime goal, is all the infectious as well as zoonotic diseases, the protection of to maintaining the biosecurity. Next, please. So the appropriate use of personal protective equipments, correct cleaning methods, and quarantine protocols are example of some of the more typical biosecurity measures that are implemented in cattle production or in field condition. The use of vaccination is another key technique for avoiding and managing diseases that can affect food animals and as a human also. Next, please. So we can summarize the principles of this infection control and prevention biosecurity. We should always know the transmission, the direct contact transmission, fomite transmission, aerosol transmission, oral transmission, vector-borne transmission, or zoonotic transmission. So having the information about this, we can easily make roadmaps to control an outbreak of a particular species or a disease condition affecting multiple species. Next, please. So again, there are some principle include although completely eliminating infected animals from a facility is unlikely, means we cannot approach each and every individual or in case of an outbreak sometimes the field conditions are of such type that we depends on so many factors like the diagnostic techniques the diagnostic results and then availability of particular vaccine or then the economy also in case of LSD. Initially, we face a very crisis for the in case of humans, the COVID time, we face and we have faced. We all know that when the situation was very critical, there was a very high demand of vaccine. So at that time, the situation we have to manage accordingly. Some engineering controls means the uh, availability of these sterilized uh, equipments or the collection sampling collection material also make a task very very challengeable to field veterinarians. So the we can say the preparedness of field veterinarians for a coming outbreak may help in eliminating or at least controlling the situation of an outbreak at an early stage. That's why I am again sir, advising the newly appointed field vets that you must have knowledge of your area this disease have been reported earlier, and that will help you in preparing yourself for any outbreak condition that may happen in future. Next, please. This includes the administrative controls, as we know that during an outbreak condition, some administrative decision have to be taken accordingly. So this also required at an early stage. Next, please. Next, please. So this implementation of infection control program, we all know that it includes environmental cleaning, disinfection, hand hygiene, means personal hygiene of a field veterinarian, a sequence of putting and removing the personal protective equipment PPE. As a field veterinarians, when we have to collect the samples from an outbreak condition, the dead animals, we must have the PPE kit available. So, but when it is available, we all know that how to wear it or how to put it off. The basic information we must have. So this includes the sequence of putting and removing the CP, identifying the high risk patient which animal may be suspected, entering and exiting isolation and dedicated areas of high-risk patient, necropsy procedure, and checklists of key tasks are known to improve compliance throughout the practice workplace, including infection control and the reduction of HAI, means hospital-acquired infection. Sometimes the veterinary institutions itself may act as a contamination or spreading the infection to the healthy individuals. So maintaining the good hygiene, good sanitary condition, good in disinfective procedure at your hospital or any veterinary institution is very much needed to lower the chances of occurring infection in healthy individuals. Next, please. Next, please. This slides give you the basic information how we use the hand sanitizer or any soap water during hand hygiene. So this I think it is I just collected this information to share you all the field veterinarians because in a routine practice we just overlook these practices, but it is scientifically proven that if you not apply the hand sanitizer or soap and water for a particular time period, that will not help in you to remove the chances of infection. So we have to keep in mind that how we start the hand sanitizing procedures. So where first of all we have to take the we have to wet our hands, then dispense the either liquid soap or any disinfectant, then apply product all surfaces of the hands. Minimum 15 seconds contact time should be there. So this minimum time of contact with all hand surfaces is 15 seconds. Then we have to rub our palms, then back of hands, then between fingers, then fingertips, thumbs there, then wrist. Next, please. And after that, we have to rinse our surface of hands with water. Then we must dry our hands thoroughly with a single use towel and rub hands until dry. Then we turn water off using dry towel to avoid direct contact. Then we must discard the towel. So single use towel or any disinfected tissue paper should be used, and the total time for this hand wash, soap and water should be up to 30 seconds to 60 seconds, means at least for 1 minute. And in case of this hand rub with uh, liquid soap or any hand sanitizer, it should be up to 30 seconds. So in a routine practice when you are using your daily hand hygiene practices, must apply these or these products for at least 1 minute so that it helps in protecting not only you but also the chances of spreading infection from infected to healthy animals can be eliminated. Next, please. So this slides give you the steps in putting on and putting down the our personal protective equipment PPE. So we first, when putting on, we should perform hand hygiene, then put on the shoe covers, put on gowns, then put on mask, then put on eye protective, then in last we should put on gloves. And while removing or doffing or taking off this, we must first remove our shoe covers, then remove gown and gloves together. Then we have to perform hand hygiene, then we have to remove our eye protection, then we have to remove our respirator or mask, and again we have to perform hand hygiene. So these slides give you a basic information how we should wear a PPE kit or how we remove this PPE kit during sample collection or any post-mortem procedures. Next, please. Next, please. Conclusion. Next, please. So, this I must significance is that the preventive medicine covers the largest percentage of all diseases occurring in field condition, not only field condition, but sometimes in indoor, particularly the diseases that affecting multiple species, they are very much of importance, and the food producing animals for particular biosecurity measures to improve the international trades also. The ecological and host diversity because infectious organisms, as you know, bacteria, virus, fungus, microbes, and host diversity, cattle, buffalo, sheep, goat, swine, poultry. So the host diversity as well as the pathogenic diversity makes it is very much important that we must have the basic information, basic knowledge about these diseases. And the diagnosis must be prompt and definite to treat the case and also to control and eliminate the economic losses. The surveillance, monitoring, and vaccination program should be regular. The regular field visits of a particular dairy farm or animal facilities should be conducted, and now, to make sure that her health management should be maintained at optimum level by using the scientific conditions, and the owner at the same time always be given advice to follow the animal welfare by covering this animal welfare. We can easily, I think, we can easily sensitize farmers to their animal farms to be maintained in a better way as compared to uh, particular being maintained as earlier. Implementation of infection control, prevention, and biosecurity measures. Next, please. So this preventive veterinary medicine and this inform infection control prevention of biosecurity in particular is at the heart of the veterinarian's place to protect animals' health and welfare and public health, as well as the universal mandate among the healing profession to first do not harm. As such, effective ICVP infection biosecurity is dependent on the development and adherence to the standardized processes and protocols followed by self-audit and protocol adjustment. So this sentence give emphasis. The self-audit means as a field veterinarian, you must always keep in mind the significance of these infectious diseases. Next, please. So, veterinarians, uh, to achieve the herd health, we need a teamwork. So a veterinarian's team best work can be undone by a breach in infection control, prevention, and biosecurity. If any breach is there, such a breach in the practice can lead to socio-economic impacts and damage to the national economy. The skilled veterinarian should always improve his or her current efforts to limit the pathogen exposure from entering or being transmitted through the population and using surveillance method to detect any new entry of a pathogen into the practice. Next, please. So the new focus areas of preventive veterinary medicine and public health includes food hygiene, animal products, and biosecurity. All these the foundation for modern veterinary preventive medicine and the public health training courses for veterinary students, field veterinarians, and Most graduates of veterinary institutions across the globe today have extensive training in population health, preventive veterinary medicine, zoonotic diseases. So, continuous efforts of all field veterinarians basic information, basic knowledge about the coming emerging diseases as well as pre-emerging diseases to achieve the ultimate goal of this preventive medicine means to protect or to maintain the biosecurity. Next, please. These are the references, and I think this is last. So thank you very much. I am again thankful to you all for listening me patiently. If you have any question, you may